Good afternoon and welcome to the board meeting of NHS West Yorkshire Integrated Care Board. Hello, my name is Cathy Elliott. I am Chair of NHS West Yorkshire. Welcome to our meeting today in Huddersfield. Welcome to all colleagues around the table, board members and attendees and advisors. And welcome to a number of people who've joined us in the room here to observe the meeting. And also for those people who are watching live online or watching on record afterwards. Thank you very much for the interest in our work across West Yorkshire. We've got a number of people around the table, and I know it's very helpful for anyone watching the meeting in person as well as live stream to understand who's around the table. And we do have a mixture of board members, advisors, attendees, and some guests today coming to talk to us about our inequalities work. So Kate, would you start us off and we'll go round the table to introduce everybody.
Hello everybody, I'm Kate Sims. I'm the Director of People for the West Yorkshire Integrated Care Board.
Hello everyone, my name is Fatima Khan Shah. I am the West Yorkshire Inclusivity Champion, which is a shared role across the Combined Authority and the Health and Care Partnership, advising the board on equity and social justice.
Hello everybody, I'm Kim Shuttler. I'm the Voluntary Community and Social Enterprise Sector Lead.
Afternoon everyone, I'm Melanie Brown. I'm Place Lead for Wakefield. Pleased to meet you all.
Hi everyone, my name is James Thomas. I'm the Medical Director for the West Yorkshire Integrated Care Board.
Hi everyone, I'm Hannah Davis. I'm from Healthwatch Leeds and I'm here on behalf of the other 6 local Healthwatch working across West Yorkshire.
Hi everyone, my name is Keir Shilliker. I'm the Programme Director for Mental Health, Learning Disability and Autism, and I'm here for Sarah Munro.
Hi everybody, I'm Karen Jackson and I'm the Sector Lead for Community Services.
Hello, I'm Richard Vautry. I'm the Primary Medical Services Member on the board and a GP in Leeds.
Hello, I'm Carol McKenna. I'm the Place Lead for Kirklees.
Good afternoon, everyone. I'm Majid Hussain, non-exec member, and I lead on inequalities and people. Thank you.
Hi, everyone. Amy Willett, Head of Corporate Governance for West Yorkshire ICB.
Hello, Laura Ellis, ICB Director of Corporate Affairs.
Hello, my name's Rob Webster. I'm the Chief Executive.
Hello, I'm Jonathan Webb, Director of Finance and Deputy Chief Executive.
Hello, my name's Ian Holmes. I'm Director of Strategy and Partnerships and the other Deputy Chief Executive.
Afternoon, everyone. I'm Ranshu Chatterjee, non-exec member for the board and Vice Chair supporting Cathy. Also chair the Finance Investment Performance Committee and the Transformation Committee.
Rose Patton, here in my capacity as Place Lead and Accountable Officer for Bradford District and Craven Place.
Hello, I'm Lou Auger. I'm the Deputy Director for Planning and Performance and I'm here on behalf of Anthony Keeley.
Hello, I'm Brendan Brown. I'm the Chief Executive representing the acute trusts across West Yorkshire, commonly known as WIAT.
Hello everyone, I'm Victoria Eaton. I'm here as a partner member for the Directors of Public Health for West Yorkshire and I'm the Director of Public Health in Leeds.
Hello everyone, my name is Tim Riley. I'm here as the Place Lead for the City of Leeds.
Hello, my name's Rachel Loftus. I'm here deputising for Mariana Pexton, who's the new Interim Chief Executive for Leeds City Council on behalf of all of the West Yorkshire councils.
Hello, I'm Robin Tuddenham. I'm the Place Lead for Calderdale and the Chief Executive of Calderdale Council.
Hi everyone, I'm Jane Madeley. I'm a non-exec member and Chair of the Audit Risk Committee.
Hi everyone, Richard James, Consultant in Public Health for the Mental Health, Learning Disabilities and Autism Programme.
Afternoon everyone, I'm Sarah Smith. I'm Deputy Director for Population Health at West Yorkshire ICB.
Hi everyone, I'm Simon Mirza and I'm the Associate Director for Children, Young People and Families in the West Yorkshire ICB.
Great. Thank you very much, everybody. And the wealth of expertise we have around the table is phenomenal today. It feels like a little bit of a public health takeover, which I'm very happy about today as well. So thank you. Victoria, warm welcome to you. I know that you're successor to Rachel Spencer-Henshaw, so we're delighted to welcome you as a new board member. And Rachel, thank you for representing local authorities today. And we will be welcoming soon Mariana Pexton as the interim partner board member for local authorities. So, and we particularly want to thank Tom Reardon and Rachel Spencer-Henshaw for their contributions over the last 2 years as part of our setup as an integrated care board and as a board in our governance arrangements. So we have a number of things on our agenda today. Colleagues, you'll know, I hope you can see, that all of them connect with our board assurance framework, the strategic risks that we need to have oversight of and mitigation, and also the 4 purposes of an integrated care system wherever you are in the country to improve the outcomes in population health and healthcare, tackle inequalities in terms of outcomes, experience and access, enhance our productivity and value for money, very much a theme in the NHS at the moment, and the NHS's support in furthering social and economic development. We've got a number of things today and on the agenda, and our focus on session is going to be looking at the ICB's role as a commissioner and a convener of the partnership in terms of reducing health inequalities. And I'm grateful to Sarah Smith and other colleagues in public health that are taking on this brief to bring this to us as a board to work out what our role is, the actions and the decisions that we can make. And you'll see today that we'll be looking at children and young people's services across West Yorkshire. We'll also be looking at winter planning, and I know Lou, you and colleagues, including with Wyatt and across our place systems, have been getting prepared for that, which began in July, probably really began in March, probably began last year, and you're already looking ahead to next winter as well as this forthcoming one. And what I'd really encourage you all to do today is making sure that we're making those connections with the risks we can see in our board assurance framework and corporate risk register, with our aims, our targets and our ambitions, which is one of the reasons why we're bringing together the integrated performance dashboard and continually improving it, and also connecting it very clearly with our AAA reports from our variety of committees. So that's an overview from me. I also want to welcome Muz, who has joined us. Muz Mumtaz is with us on placement in a non-exec director development opportunity, which is part of a national scheme through Gatenby Sanderson, which is the Insight programme. This is part of our commitment to supporting succession planning and greater diversity on boards. And this is our first placement we're taking on, and you'll meet someone in about 6 months as well. So I'm really pleased that we're working together across all trusts, as well as the ICB, on talent development and our talent pipeline as well. The other thing before I get into the meeting business, I want to thank our governance team who tirelessly worked very hard, but I know this has been a really good preparation that we've had in going for this meeting today, as well as the annual general meeting we had earlier today. So thank you so much on the smooth preparation for today's series of meetings. So we'll take apologies. Laura, would you just talk those through?
Thank you. Yes, we have apologies today from Sarah Munro and Keir Shilliker is deputising, Anthony Keeley and Lou Auger is deputising, Showkat Ali Khan and Rachel Loftus is attending on behalf of our partner member for local authorities. Thank you.
Great, thank you. Can I take any declarations of interest in connection with today's agenda, or is there anything to share for this board meeting in public? No. Having a look around the table, no. And again, a reminder to colleagues around the table to keep the register of interest live. It's a live online portal available to the public as part of our accountability and the ways in which we record declarations of interest. So we're now going to move on to item 4, which is an urgent decision in relation. Oh, sorry, we'll do the minutes first. Yes, let's do the minutes first. Okay, let's do the minutes of the last meeting in June when we were together in Ilkley. Colleagues, do you feel that's an accurate record of our meeting that day? Looking around the table, there are no corrections at all. Everyone happy with that? If you remember that hot day in Ilkley when we came together there. Do we have any matters? I've got a couple of matters arising. If we go to the action log first, and then I'll cover the matters arising.
Thank you. We just have a small number of actions. The first 2 are proposed for closure, and there's an update within the papers. And the third one relates to the digital strategy coming back to a future meeting, so we do have that on the work plan. There wasn't anything else to pick up.
Thank you. I just wanted to check in on the digital strategy. Our next board meetings, we have our December. I wondered, James, would you just give us an overview of the timetable for that strategy?
So we've had a digital strategy in place now for a couple of years across West Yorkshire, which we are implementing. I think given the new appointment of the Chief Digital and Information Officer, it's kind of looking at reviewing that and then bringing that back here. So I think it's timely. The new CDIO is now in place, although, so I think looking at that, I suspect it will probably be early next year, to give him time and also the team's time to kind of review that there, but if that's okay with the board.
Thank you, James. I think that's helpful. Shaukat will join us, our new Chief Digital Information Officer, from our December board meeting in public, and then we could then plan ahead to March. So thank you for that. The other point on the action list is around the update on the Fuller Delivery Board and the work in primary care, which we have in Rob's Chief Exec report, which we know our Quality Committee was looking at in June. Rob, just a quick update. We talked last time about the NHS England Regional Director. We sadly said goodbye in retirement to Richard Barker. Would you just give an update on where that is for us for the North East and Yorkshire region?
Yeah, so Richard had a portfolio that covered 2 regions, North West and North East Yorkshire and Humber. And NHS England have been going through a process to recruit successor. And have done so in the North West, but not yet in the North East Yorkshire and Humber. Robert Cornell is acting as the regional director and working closely with Robert, including continuing our 4+1 arrangements, where the 4 ICB chief executives and the regional director meet every Thursday.
Great, thank you, Rob. So we'll now conclude that item and move on to the urgent decision, item 4, which is the approval of the joint forward plan. Laura, could you just give us an overview of this? We're being asked as a board to ratify this.
Thank you, yes. So this was a decision that we had to take through our urgent decision process after the last meeting. We did talk about the joint forward plan last time. So this was the formal approval and publication on our website by the end of July 2024. The details of the decision are set out within the papers. It's just for ratification today.
Board colleagues, are you happy to ratify that? Yep, I see nods around the table. Thank you very much. Okay. We now move on to public questions. Colleagues, as you know, we always invite questions from members of the public for both our NHS West Yorkshire Board meeting and our partnership board for our Health and Care Partnership, both of which happen on a quarterly basis. So we have a question today from Dr. John Puntis, which I'm going to hand over to Laura first of all.
Thank you. Yes, we've received a question from Dr. John Puntis, Leeds Keep Our NHS Public. I'll read out the question and then I'm going to pass to Ian Holmes to provide a response. So the question is, becoming a health and care partnership of Sanctuary in March 2023 is testimony to the excellent work around migrant health in West Yorkshire, which I would wish to acknowledge. The King's speech referred to the NHS being a service for all, providing care on the basis of need regardless of ability to pay. There are, however, an estimated 1 million undocumented migrants in the UK, of whom a quarter are children. Undocumented migrants are not eligible for most secondary care services. In this sense, the NHS has long ceased to be a provider of care for all based only on need. While there is a legal obligation for provider organisations to apply the inappropriately named charges for overseas visitors regulations, fear of charging may inhibit interaction with health services. There are also many cases of people being charged sums of money for care received far beyond their means to pay, with the potential for this to adversely affect their application for settled status. Does the board accept that charging for many secondary care services may have an adverse effect on the health of some migrants? And if so, what steps is it taking as a partnership of Sanctuary, both to assess and mitigate the degree of such impact? Thank you. I'll pass to Ian.
Yeah, thanks, Dr. Puntis, for the question, and thanks for joining us today. So, as an ICS of Sanctuary, we are committed to ensuring that everyone, including undocumented migrants, can access health care. We understand the point that you're making, that the national policy around charges for overseas visitors, those regulations can act as a barrier, deterring vulnerable groups such as refugees, people seeking asylum and victims of violence from seeking necessary and appropriate care. We know that many of these groups are exempt from charges, so people seeking asylum, victims of violence are exempt from those regulations, but we do recognise that the fear of being charged for services can act as a deterrent from accessing those services. So we agree with the general thrust of the question. We think there is a risk of people not accessing services that they need. We're doing a range of work through our ICS of Sanctuary arrangements. I'll just give you a few examples. So we've partnered with an organisation called Doctors of the World to provide safe surgery training, with over 60% of GPs in West Yorkshire now trained to deliver inclusive, non-discriminatory care. We've worked with an organisation in Bradford called Bevan Healthcare to provide information and resources for refugees and people seeking asylum so that they can understand their rights and navigate NHS services to get to the right place. We're working through our Health Inequalities Academy and Health Inequalities Network to assess and reduce barriers in healthcare for migrant populations, ensuring that our services are both accessible and supportive of those who have the greatest needs. We've done specific work around dental through our inclusion health dental access programme, so we're providing specific support for people seeking asylum for dental needs. We're developing mental health resources in partnerships with Solace, and we've provided support on primary care inclusion health commissioning. Finally, we're working to embed trauma-informed approaches to all the work that we're doing. These will help ensure that services are accessible, inclusive and sensitive to the needs of vulnerable populations, and the aim is that this will reduce health inequalities and improve access for all. So, important issue raised, thank you. We recognise the issue raised, and we are doing a lot of work under the ICS of Sanctuary arrangement to try and address those risks that you've outlined. Thank you.
Thank you very much, Ian and Laura, and thank you, Dr. Pontus, for your question. I think it's been very helpful to spend the time in the last 24 hours answering that and looking at good best practice, but also giving us food for thought in future work. And we will probably come back to the services for refugees and asylum seekers later on in the meeting as well, particularly for work going on in certain places in our system. Okay, so we're now going to move on to our focus on session, and sometimes this feels a luxury to spend nearly an hour focusing on an issue or an area of service. For us, we have a role in reducing health inequalities. My question to you is, what is our role as a commissioner? What is our role as a convener of this partnership? And I'm going to now hand over to Sarah, Simon and Richard to give us an overview. Then we'll come to Hannah in representing Healthwatch. And then it's open to discussion really to hear from you as board members and board attendees, your thoughts, as well as what we might be able to do in the short to the medium term. So Sarah, to you. Would you introduce yourself, Sarah?
Thank you, Cathy. Afternoon again, everyone. I'm Sarah Smith. I'm Deputy Director for Population Health at West Yorkshire ICB. So, as Cathy said, it's great we've got this focus on session, and really welcome the focus on health inequalities at the ICB board and the opportunity to come and discuss this with you today. So, just for a bit of background, so Richard, Simon and I are just going to give sort of a 5-minute overview of the paper. We're assuming people have kind of read the paper and hoping people have had a chance to look through the intelligence pack as well. I'll summarise the recommendations, and then, as Cathy said, we will then get onto a bit of a discussion about this. The paper comes from an ask of the board to have focus on sessions on health inequalities, and we decided to take a life course approach to this. So what this means is we focused on adults and working age adults at the last meeting. Today we're going to focus on children and young people. And what we really want to do is focus on what's the role of the ICB boards. We know there are a lot of factors that affect the inequalities of children and young people. Lots of things like the determinants of health, so where they live, their education, etc. But what we really wanted to focus on today is what's the role of the ICB board in understanding and addressing inequalities for our children and young people. We know in West Yorkshire we've got a younger than average population, so this is a really important area for us because we've got more than the national average of children and young people, particularly in Bradford, that's got the second highest number nationally. And we've also got more children living in poverty than the national average as well, which impacts quite significantly on health inequalities. Today we're going to focus on healthcare, public health, and what we mean by that is the areas that, again, the health system can impact on. And there are 5 areas nationally that have been set out from an inequalities perspective for children and young people, which are diabetes, epilepsy, oral health, asthma, and children and young people's mental health. We've provided a brief overview of all of those in the pack, and we're focusing today on asthma and children and young people's mental health, because we think those are areas where we've got significant inequalities, but things we've got an opportunity to do more on working together. So I'll come on to Simon now, who's going to talk about asthma elements and opportunities there, and on to Richard, and then I'll come back and summarise the recommendations.
Thanks, Sarah. So my name's Saima Mirza again. I'm the Associate Director for Children, Young People and Families across West Yorkshire ICB. So as Sarah points out, when we've done a deep dive into look at inequalities for children, particularly looking at asthma, we know that we've got a number of undiagnosed children that do have asthma. We also know that the higher the level of deprivation, the higher the prevalence of asthma. And we see that through the trends in emergency department activity as well as in primary care as well. We recognise that there's social economic barriers to access as well, and again that links with what the data is telling us. So we know that there's challenges around inequalities, how our young people and families access our services. So what are we doing about it? I think hopefully you've had an opportunity to have a look at the paper, and there is some action that is taking place at system level, place level and neighbourhood level in tackling improving asthma care for children and young people, but looking at that through a deprivation lens. I'm not going to go into too much detail because hopefully the detail's in the paper, but just to give you a few examples that I'd like to tease out. There's some work around housing and health that's happening across West Yorkshire. So we've established a housing and health group which is representative of private housing providers as well as health colleagues and the third sector, and we're working together as a partnership to really tackle that link so that we can highlight the distinct link between poor housing, fuel poverty and the impact on children's health. What that group's been able to do is draw up some common principles that we can work with. You may recall the sad case of our Ishak in Rochdale that died a few years ago, which was due to mould. So we've really taken that law that came in last year to design these common principles and look at how we improve housing conditions. Other things that we've done is increase the number of asthma-friendly schools. We've now got 160 asthma-friendly schools across West Yorkshire, which means we've got that partnership working with education. And it also means that children have their needs met where they're at. They spend a lot of their time in school, and we're working with schools to be able to provide that level of support in schools. There's also a number of models across places. So Leeds have done some work around the Seacroft primary care network area where we see a lot of inequality, and they're doing some targeted work such as providing hyperallergenic bedding to families, supporting them with fuel poverty challenges and how we can involve the third sector. And there's reference in the paper to Green Doctors, which is a charity that we've used as well to try and support families with that fuel poverty. There's different models across Bradford. Bradford have got something called the ambulatory care experience model. And again, that's a targeted intervention approach to work with the education sector, primary care, to support that lens on inequalities for asthma and reducing that as well. So I'll leave it there. I think hopefully the details in the paper, but I hope that gives you some oversight into work that's taking place. We'll come on to talk about the ask of this board in how the board could help us. So I'll pass on to Richard. Thank you.
Thanks, Simon. So I'm Richard, consultant in public health in the mental health, learning disabilities and autism programme. And I hope the papers that we shared with board have really demonstrated the scale of inequality that's facing children and young people around their mental health. We've seen that inequalities exist in the prevalence of conditions, in access to prevention, to diagnostics and to support, and in a wide range of eventual outcomes. But I think we've also seen that understanding the exact distribution and nuance of inequality across our diverse population of children and young people is essential, but there are limitations around our existing data and intelligence systems that currently make it really challenging to do this. It's, as Sarah said, it's really welcome to see board recognising this area as a priority. And whilst we need to address inequalities in access to secondary mental health services, I think a lot of the existing good practice that we shared in the paper demonstrates the need and the opportunity as a system to think about the bigger picture around this. And we've seen the need to think about early intervention, which isn't always just quick access to services like CAMS. It's about acting upstream as early on in the life course as is possible. We've seen the need to think about alternative models of care and the fact that secondary services aren't always the answer for everything or for everyone. And as a system, we've seen that we have to treat people holistically and with proportionate universalism and prevent those with mental health conditions, with learning disabilities and with neurodiversity going on to have poor experiences and outcomes across our wider health and care system. So I think Sarah's going to touch in a second on the recommendations in a bit more depth, but for this area, we try to ensure they reflect the need to improve our intelligence around health inequalities if we're serious about reducing them, and to ensure that we have that mutual accountability across the system. and don't see mental health, learning disabilities and autism as separate issues for separate services, but key areas we all need to get right to provide holistic care for all our children and young people. So thanks for your time. I'm looking forward to listening to the upcoming discussion. I'll hand back to you, Sarah.
Thank you, Richard. Thanks, Simon. So I think that gives us a bit of a flavour of some of the work going on across the partnership and the ICB's role as part of that wider health and care partnership, linking in with our local authority public health colleagues, for example. I think encouraging the board to focus on, as Sam and Richard have touched on, the access, outcomes and experience of our services in order to address inequalities for children and young people. The recommendations are kind of based on that and summarise the role that we think we can take as an integrated care board in better understanding and reducing inequalities. So there's a specific ask around our subcommittees. So we'd really like the board to do some thinking about what the role of the subcommittees could do in addressing some of the inequalities outlined in the paper. There's also ask around intelligence. So as board members are aware, in order to address inequalities, we need to first understand what they are and target our approach using intelligence. And we think we could do better at this in terms of children and young people's mental health and asthma as well, and perhaps align these to some of the partnership ambition work that we've got. But we'd encourage the board to think through how we can make better use of intelligence to do that. And then finally, there's a recommendation around representation and voice of children and young people. So we'd really like the board to reflect on how we get the voice of children and young people to the board, how we hear from children and young people, and how we use that to better understand the inequalities, but also how we address them, because we need to hear the voice of children and young people in order to understand what we can do about these inequalities. So really welcome the feedback we've got from Healthwatch already on this, and we'd like to kind of form that as part of the discussion as well. So thank you, Chair.
Great. Thank you, Richard, Sarah and Simon. Hannah, can I hand over to you? Would you introduce yourself? People watching online always like a reminder of who people are.
Hi, yeah, I'm Hannah Davis. I'm Chief Executive at Healthwatch Leeds. I'm here on behalf of all the local Healthwatch working across West Yorkshire. Big thanks to Heather Thrippleton, who wrote this report, who has now gone off to have her own baby. So particularly important for this discussion for Heather and her new baby, Penelope. And big thanks to all the people that engaged with West Yorkshire Voice and all the other partners that work with us on bringing together this insight. Should say there is a lot of insight around children and young people's experiences, and I think that last recommendation around children and young people's voices is so important. It should be that for all our services, but particularly around children and young people. In terms of developing this, we developed a questionnaire which was sort of, we asked some questions around what helps you or your children you care for to stay healthy and well, and what gets in the way of staying healthy and well. So I really want to get that whole picture around people's experiences, children and young people's experiences. West Yorkshire Voice, which is the network which brings together lots of different organisations and voices to be heard here at a West Yorkshire level, were part of this work, and special thanks to a number of groups who got involved with this work. So Gender Space at Bernardo's, Neurodiversity Co-Production Group from Touchstone, Just Be, Refugee Council, North Yorkshire Together, Star Bereavement, Wakefield and Bradford Send Services, amongst others. So many thanks to those. And there are some community testimonies in the back of the report that hopefully people have looked at, which hopefully give really good insight around people's experiences in those different areas. I suppose the key messages around it, and I think we went generally around health and well-being with a focus on asthma and mental health. From an asthma perspective, people have asked for, what helps, and I think that point that Sarah's making there around what can health and care services do. Again, it's that recurrent theme around good information, around being supported to stay well with the condition that you have, good information for parents and carers, good access to how do you support your child with asthma, but also what happens when things go wrong. Good access to medication and regular reviews. Again, people highlighted that would be, that's really important in terms of supporting people. And then people highlighted those wider environmental factors of allergens and air pollution, so housing and green spaces. And actually green spaces came up quite a lot in the feedback that we got from children and young people about what keeps them well. In terms of mental health, and I think that's a big focus of the feedback that we got, as Richard's already mentioned, early intervention is key. Children highlight they need to be supported in a safe, secure and trauma-informed way. These words sound simple and they sound like that should always be the case, but that isn't always the case, and it is very important for children and young people. Children and young people share the ideas around how they look and manage around their own well-being, and what gets in the way, and again highlighted green spaces and cost of exercise and cost of activities. I think particularly from parents and carers, we heard again around good information and around how they can support their children and young people going through mental health experiences. And often that isn't provided for children and young people's parents. And a sort of a focus on the responsibility of parents and carers to be doing the work around supporting their children and young people when actually they needed support themselves to play that role. And then lastly, just in terms of mental health, they're highlighted around long waiting times and complex referral routes, and we know that that's a significant issue in terms of accessing mental health support. And just in general, in terms of health and care services and making them accessible for children and young people. Again, the theme of communication and information came out around children, young people and families needing good information when their children need access to health and care services. Different modes of delivery, so services thinking around things like texting, WhatsApp, video calls. Children and young people access support in a different way, and we need to be able to respond to that from a health and care services point of view. Access to care and how to access care. Do children and young people know how to book appointments themselves? How do we make that simple for children and young people? What does that look like? A long waiting list as well has already been highlighted. And people highlighted reductions in what is available to children and young people happening already, such as things like activities in terms of keeping them well. Children and young people highlighted healthy living. People do want to stay well, but actually the cost of doing that is prohibitive for some communities, and I think that came out as a theme around poverty and people wanting to eat well, people wanting to access green spaces, but actually those aren't available for many people. And then the impact of actually living in poverty and the mental health stress that has on children and young people actually having to live in poverty. And as we've said already, that's a significant proportion of the children and young people that are living in West Yorkshire. They also talked about the impact of healthy relationships, the influence of culture and community on staying well, with certain communities not having different approaches to mental health and being able to talk readily around mental health. And the key role of education around that. So there was a lot there that children and young people saw, but I think what's interesting is they talked specifically around what health and care services can do differently for them, but also around those wider determinants such as green spaces and poverty. There are quite a lot of key messages and recommendations in Heather's report, but again, I think looking at them, they are quite health and care specific actually, so I will go through them if that's okay. So in terms of asthma, we talked about regular health checks should be provided for all children and young people, including medication reviews. Medication should be available to all as required. This should be easy and free to access, and advice given on how, when to administer this. Information, education and signposting should be delivered into communities to build confidence in families to manage conditions like asthma. This should include causes, symptoms and prevention. And some of wider determinants, all children and young people in West Yorkshire should be provided with good quality housing that is warm without damp and mould. In terms of mental health, care should be centred around the needs of each individual and should take account of every aspect of people's lives. Children, young people and their families should be fully involved in their care. Children and young people should be treated with kindness and compassion and given a safe space to talk and be listened to. There is a key link between compassionate care and children and young families' confidence and trust in services. Work needs to be done to cut waiting times and provide more timely access to much needed services. And then on a general theme of health and care services, communication should be simple and clear. Information should be provided in a format that meets the children, young people and parent carers' needs. Good communication can greatly improve the outcomes of children and young people and minimise some of the potential harm caused by lengthy waits for treatment. Communication should involve the children or young person. Where this is not possible, appropriate services should work to involve the children or young person as much as possible in their own care. Timely access to early interventions and ongoing support where needed, should be prioritised. It's important that children and young people are given the tools and education to be able to access services independently, for example, booking appointments. The additional challenges faced by those at risk of the greatest health inequalities and their needs and preferences should be recognised and supported by all services. Cost of keeping well. Free memberships at local gyms and leisure centres should be provided for children and young people who cannot afford to access these. An increased provision of youth activities should be provided at no or low cost in safe community spaces. These should be accessible to all. Additional support should be provided to families who cannot otherwise access healthy food, and information shared on the benefits of a healthy diet where needed. Additional support should be provided where possible for travel to appointments where needed. Healthy living. Every child in West Yorkshire should have access to healthy food and education on how to maintain a healthy diet. Access to outdoor and green spaces should be improved for all children and young people in West Yorkshire. These should be safe and easy, accessible, that encourage activity and exercise. And on healthy communities, services should work to have greater cultural competence, awareness and understanding of neurodivergence, gender variance and the barriers faced by people from marginalised communities. Services should work more closely with education providers to provide consistent support to children, young people and families, and relevant training should be provided to schools to help support children and young people with individual needs. And I should say we did have a video actually that we were hoping to play, but unfortunately because of the tech we weren't able to play it, but it'd be good for future meetings to consider how we can make that happen.
Thank you so much, Hannah. That's really helpful. And to everyone, Heather and everyone who's contributed to that report. And thank you for listing the organisations who contributed as well. It's really helpful. So, colleagues, round the table, there's a theme around the connection between health and housing, health and education with schools. There is the theme around improving our intelligence, the role of our subcommittees. There are many of you that are part of those. Looking at representation of children and young people, good information to support your condition, environmental, which I hope Fatima is going to come in terms of housing, early intervention work, and some of the key themes you always share with us, Hannah, which is around good communication and compassion, which you've shared with us. So I'm going to start over here. I think we'll go to Fatima first, and then we'll go Tom, and then I'll make a list. Okay, so Fatima, would you introduce yourself as one of our advisors and attendees?
Hello again, Fatima Khanshah, still the West Yorkshire Inclusivity Champion. Really comprehensive report, and I really appreciate your contributions as well, Hannah, with the Health Watch report. So specifically on housing, one of the benefits of having a shared relationship and shared team across the combined authority, particularly with a focus on inclusion, is that we've been able to influence the housing strategy. So objective 3 and 4, which is quality of the existing homes, and particularly a focus on creating resilient places and well-being, have a specific focus on children and young people as part of that. I've pushed that as the Inclusivity Champion. We've also got the Child First scheme, which really focuses specifically on a child and young person-centred approach within policing and crime. And we've also really supported the work of Young in COVID, which really focuses on supporting ethnically diverse children and young people in particular with the stigma of mental health. I think there is a real opportunity though, and I do want to extend an offer of having a roundtable conversation with the Mayor and also leaders within the combined authority about some of the other areas of influence. So transport, we're undergoing a massive conversation right now. There's some great opportunities to influence that. And we're also doing some specific work on the impact of social media on children and young people, particularly with a focus of misinformation, but also supporting the Mayor's soft skills agenda too. So I suppose what I'm saying is we are making quite an impact in this space, but there's always more we could do, and there's an opportunity for us to influence it here and now. The final thing I would say though is, it was referenced in, but I wondered whether we could explore that a bit more, was the support for young carers. So we've got carers as young as 5 in this region, providing care and support. And one of the things that I think would be really helpful to explore is how do we support the workforce to be inclusive when it comes to children and young people, because it requires a specific skill set that we might need to think about how we develop.
Fatima, thank you. So there's lots of great examples there, but how do we tie it and connect it better together? And that's a lovely reminder also of the transport consultation that Mayor Braben's leading on at the moment. Deadline 30th of September. Yes, please take part in that. Okay, so we have a list of people. So we have Tim, then Bev, then Karen, Majid, AC, Carol. If I've missed you off, Rachel and Jane, we will come to you shortly. So Tim, to you first. Would you introduce yourself?
Yeah, hello everyone. My name is Tim Riley. I'm place lead for the City of Leeds. I'm also co-chair of the Children's Programme Board of West Yorkshire. We looked through and went through this paper last week at the Children's Programme Board, and in the conversation, one of the things we reflected on was that there was a need probably to set ourselves some challenging goal and objective around this. Quite a lot of the work is good work, but is it having the effect that we want? And what does that actually mean in terms of inequality and benefit to the individuals and their families? I think particularly when you think about children and young people, mental health and asthma are major factors in things like school attendance and educational attainment. So it's not just inequality now, it's inequality going forward. The other area that we also had a presentation before we got to this paper from a group of young people, or a representative of a group of young people from sort of the global majority. And I think really powerful sense of that health is often a world they don't feel welcome in, and that's been emphasised more strongly because of the kind of language that accompanied the anti-Islamic and racist riots and conversation that was happening back in August. And I think it's really important when we look at how we go about developing the solutions for this, that we look and think about that phrase around cultural competency that is very rare for some of us who are perhaps steeped in the NHS and in a certain way of thinking about the world to be able to really address some of these challenges. And I was particularly struck that we in Leeds certainly have been looking at this area, children and asthma in particular, and part of that is because some work we did with colleagues from New York, and they were really, really smart and understood which communities in a very detailed way had what kind of problems, and the communities developed the solutions. It wasn't about inhaler technique. It was about other things. And I think the danger is we reach for a medical solution. So a culturally competent socio-medical answer feels really important.
Tim, thank you. That's really, really helpful, and welcome hearing more of what you're doing in Leeds. Bev, we'll come to you, then Karen. As you speak, if I just remind you, if you'd introduce yourself, it just really helps people in the room observing the meeting as well as watching online. So, Bev, to you.
Yeah, thanks, Chair. My name is Beverly Geary. I'm Director of Nursing for West Yorkshire ICB, and I also sit on the Children and Young People's Board. So I've had the opportunity to read this paper in detail. Thanks again. I think it's really helpful. I think it highlights lots of really fabulous work that we're doing in West Yorkshire, but I know there is much, much more to do. But I think we ought to, just take a minute to acknowledge some of the brilliant work that we've done. And at this board previously we talked about children's oral health at length and some of the things that we've done about that. I'm going to specifically talk about recommendation 2 and 5, but before I do that, again, in terms of some of the work that's been done, we've got 160 asthma-friendly schools. How do we increase these? I think there's something like that across West Yorkshire in order that, can a really ambitious aim be that all of our schools are asthma-friendly? There's something about the 48-hour telephone review model, and then, Simon, what you said around the Seacroft model and the ambulatory care, and how we measure the impact of this in order that, we can engage other partners to widen this work. In response to the recommendations and the asks of this board, in subcommittees, so quite a few of us around this table sit on our quality committee. I think that a lot of this, if not all, should come, via that committee. We have a system quality group that, again, a lot of people sat around this table and others from wider partners come to do the detail. So I think there's something around the system quality group, potentially a clinical forum, and I'm almost sure if my memory serves me correctly, that we've had quite a bit on asthma that previously in young people, and there were lots of actions taken away from that. So I think that both those would come into quality committee and come to the committee. And there's also something about the dashboard. So I think, Simon, we had a different conversation when we were talking about information and collecting information, and I went, you need to speak to somebody else about that. But if you look at the dashboard and the detail that contains and whether or not we can refine some of that. In relation to the recommendation number 5 around children and young people's voices. I'm not going to repeat what Anna said, but we've had young people, again, a listening event at this board previously, and I just wanted to repeat some of the things that they said. They said something about signposting. They said loads about accessible information, and that actually, you know, that social media played a massive part in their, you know, in how they access information, and we've got to, you know, kind of look at that. And I think that specifically when we're looking at different services and how we engage children and young people's voices, it needs to be service and speciality specific, because I would caution against just having a group of young people, for example, and saying, right, what do you think about asthma, what do you think about oral health, etc., etc. I think that it's really important to engage when it comes to speciality and service level. Thank you.
But that's really, really helpful. Thank you. There's some action there as well as comments, and it's great to see already this document has been so helpful for Bev to reflect on her Director of Nursing right across the system, and for Leeds as well as a place, which is great. So we'll now go to Karen, then Majid, then AC.
Hi everyone, I'm Karen Jackson. I'm the Sector Lead for Community Services. It's great to hear this conversation, isn't it? I suppose I'm going to make an offer, which I hope you take up. So, if I think about the number of colleagues in community services who have consistent access with children and their families, and in lots of other services, it's a huge opportunity for us to understand and gather the information, because it's not just about the data. Some of this is about the soft information. So that information about going into those people's homes, their families, that's critical. And there's lots of other folk. So I think that's an offer we need to put on the table. I think what's also interesting is somebody was talking about, I think it was Tim was talking about the fact that it's quite difficult, children sometimes find it quite difficult to access. If I think about the van that we have, that we've sent out and about, and the number of children who get on of their own free will because it's not very threatening and they've disclosed all sorts of things. So I think the way we consider, the way we take services rather than bring people is absolutely critical, and we've got some great evidence about that if you want to see that. And the last thing I'd say I think is really important is we do all this fantastic work, we move the dial, etc., etc. We must think really carefully about the transition between children and adult services. If I talk to my colleagues, and I do it an awful lot in community services and with my partners in community services, one of the biggest difficulties that's faced by families and children is the move from children's services to adults. So we really need to think carefully about, having done all this great work, how we support through that process too. Thank you.
Great, thank you. So there's an offer there from our Community Services Provider Collaborative that Karen represents. Thank you, Karen. Majid, then AC. Majid, there's a point there on the Quality Committee as well. I know you're interim chair of our committee at the moment.
Absolutely. So thank you very much for the report and some real good examples of work to try and address inequalities. But even if we did that and a bit more, it'll be decades if ever we address these health inequalities. So I'm with Tim in terms of we've got to get a bit of ambition, a bit of target in there. That what are we aiming for? Because if you don't, we're just going to be plodding along. But there's going to be a lot of hard work going behind it. We mustn't belittle that. In terms of the work of the subcommittees, there's some work taking place around data, but we've got to be much more data-driven, and through the committees and broader work around data, that is something that we have got special attention to at the moment. But when I was listening to Heather and I was noting some of the words that Heather was using in terms of what people have said, it's the basics we've got to get right. The amount of times that it was said in there that we don't have the right information, we don't have regular reviews, health checks, more around health literacy in terms of cultural proficiency. How can we serve our populations effectively if you don't really know them, if you don't have that cultural proficiency? So I think there's something here about going back to basics and the very basics, what we've got to pay attention to, and that we've got to do at scale and at pace, because I think these projects do help, and these sort of asthma-friendly schools, I think they will have a huge impact. But if you don't get the basics right, this problem is going to be ongoing, and we're not going to get to where we want to get to in terms of reducing those health inequalities.
Thank you. So there's something there on data as well as striving in the next, which is the point I was hoping to make earlier, which was around short to medium term aims of what we've got. Thank you, Madge, that's really helpful. AC, and then we'll go to Carol, then Rachel.
Thanks, Chair. Arunashu Chatterjee, non-exec member for the board. So I think the advantage of going after 5 colleagues commenting on it is that you have covered a couple of things that I wanted to raise. So Tim and Majid, you mentioned about the need for ambition. So while looking through those case studies and this sort of reflecting on something that we heard from NHS England's chair as well, that we have lots of small pockets of innovations going on. How can we identify the ones that are the most effective and scale it across the system? And that sort of links to the ambition, because we can't necessarily continue to sustain so many numerous initiatives across places without linking it across the region and making sure that it is yielding the best buck in terms of and the most best outcome. Because this is thinking about the medium-term plan and the transformation priorities, how do we bring it all together? It feels like a suggestion would be is to create a, dare I say, another blueprint in terms of how it should look like. Because Kathy, we were having that chat about the WICA housing initiative, and without looking at this, we actually brought up respiratory as a key issue in terms of while looking at new plans and so forth. So integrating that looks like something of a blueprint will be useful so that we are assured that which arms of the system is looking at which particular actions, and how do we sort of then bring it back to the board in terms of the progress made over the next few months, years, and so forth. As Majid noted, otherwise it'll take decades if we just do small bits here and there and will not move the dial significantly. So that's one of the first observations. The second one was looking at the Health Watch report as well. And I think some of the things, as it comes through, it feels like significantly negative because of the response rate. So I think it might be worth looking at also the positive work that's happening across the system. Because if you look at some of the comments, things are not joined up, we are aware of that. There's like need for joining up and so forth. Making some suggestions and making much more sort of impactful, because I think there were about 29 responses. So suggestion was not to overread into that as well and sort of balance it. While it is fairly important feedback coming from colleagues, sort of members of the community who are probably affected by that, we need to try and sort of explore that and how we can improve that ability to continually get that information through. So I think just balancing that two things together would be helpful. I'll just stop at that.
Thank you. So as chair of our transformation committee, in working with Ian Holmes, who's the exec lead for that, I'd leave you to talk through blueprints together and the role. But I think this is particularly the ask of our colleagues here, is about how you take this report into your committee. So thank you, AC, for sharing that. And the meeting you shared there that we had with West Yorkshire Combined Authority was looking on how we're aligning our infrastructure plans for the NHS estate, breadth and depth of it, alongside West Yorkshire Combined Authority's plans for infrastructure linked to housing as well. So we have more colleagues who want to contribute, which is great, thank you. So we're going to go Carol, then Rachel, then Brendan. Oh, sorry, Carol, then Rachel, then Jane.
Thank you. And thank you for the paper and the presentation. It's really interesting, and actually it's really timely as well, if I think, oh sorry, I should have said Carol McKenna from Kirklees. So thinking from a Kirklees perspective, because it mirrors a lot of the conversation that we've had over the last couple of months in Kirklees in particular. And it's really helpful to hear talk about, the housing and health connection, for example. That's an area where we have had discussions in our clinical and professional forum. It's prompted a sort of reconsideration of things like asthma pathways, but also building on some of the wider connections and work that's happened with some of our PCNs in the areas of greatest need, which I think picks up on that point that some of these clinical issues are not just about clinical pathways, they're about that wider context in which people live. Likewise, Kirklees Council have recently been through their ILACS inspection, and don't feel I could let this conversation pass without noting that they did come out with a good result from that, and in particular some really positive outcomes as to progress made in relation to children in care and children leaving care. And we know that that group of young people often experience health inequality and disadvantage, so it's really heartening to see that coming through from that inspection. We had a similar conversation, and a couple of colleagues around the table will know, we had a similar conversation in our last committee actually in August, where we focused on our Starting Well programme. And a lot of the discussion there led us down the mental health and wellbeing, as well as the challenges around assessment times for neurodiversity. And no easy answers on that one, obviously, but recognise that connection with the work that we're doing at West Yorkshire. So I suppose for me, it's maybe not explicit in the recommendations, but it is timely to consider again what are the elements of this work that really we add value if we do together at West Yorkshire. What are the elements that are in place? And actually a lot of it really then starts to happen in neighbourhoods, so there's that sort of tiering of an approach and a strategy, rather than everyone trying to do everything once, which I don't think we are, but maybe being able to articulate that really clearly would be helpful to us.
Carol, that's really helpful in taking those recommendations. So there's an ask specific around committees, but what do we do at West Yorkshire level? What do we need others to help us with outside of West Yorkshire? I'd add to that, and then place and neighbourhood, which I think would align then with the work, Ian, that you're doing on integrated neighbourhood teams blueprint as well, which colleagues are contributing to. Thank you, Carol, that's really helpful. So we go to Rachel, then Jane, then Brendan.
It is on, sorry. Reflecting on this, Rachel Loftus from Local Authorities. Reflecting on this from a local authority point of view, there's a few things to really consider. One is the demographic factor of the number of children living in the areas with the most deprivations is increasing at a faster rate. So the scale of the challenge is increasing at pace. Unfortunately, the scale of response isn't. So there's lots of helpful things, and thanks to colleagues who've already raised around the housing strategy and the plans to put in place better quality housing for more children. But that is actually going to be a generational impact. And so actually what we have to do is look at those mitigations that are available to us. It will come as no surprise to say that the challenges in local government finances means that we have not been able to invest in those mitigations as much as we would like to have done. However, when we see that the absence of mitigations is causing cost both in local government and NHS, it seems insane that we wouldn't be able to look at different ways of doing that. And I think the dawn of a new government gives us some more opportunities to do that. I think we've had incredible success in the small pilot areas that we've run in West Yorkshire through health and housing. So those small mitigations, everything from better quality mould spray being available in food banks. You know, a £4 mould spray is so much better than 4 £1 mould sprays, but that's not always what you get available. And so there's things like that where heating on demand, laundry on prescription, those are things that where we've seen we can actually make those mitigations successful immediately, but what we've not been able to do is scale those programmes. So what we'd like to be able to do is get to the point where it's more likely in West Yorkshire, if you're facing these challenges, that you get those interventions than less likely. And I think there's something in that where we can try and look again and say our collective investments are not getting the impact we would like at the scale we would like to do, and re-look and see if there's a different way of investing, but also maybe to attract some more national investment in this.
Rachel, that's really helpful in answering that short to medium term response that we need, that then links with what Fatima offered earlier. Okay, so that feels something to take away to look at as well through the recommendations. I want to make sure everyone gets to contribute. So we're going to go to Jane, then Brendan, then Therese.
Thank you. So Jane Madeley, I'm the non-exec member and chair of Audit Committee. So yeah, I had two questions, particularly around the children's mental health side of things and the focus on that. The paper is really helpful, and lots of interventions and things that are going on are mentioned there. But I was also conscious in my exec day job, I work at the university in Leeds, and we also have lots of conversations about provision of care and how we support students coming through to the university and who also develop challenges whilst they're with us, and how we ensure, have we got enough support, how do we best signpost young people as challenges emerge. But I think some of that discussion then becomes about actually those who present themselves and actually do step in and try to access services, you know, that's one cohort, and it's really important that we try to provide, but we're kind of more increasingly and maybe more worried about those who still don't just recognise the need to access it. And I guess my question is whether you feel that we are doing enough across the system to encourage young people to sort of recognise and come forward with their into the services to try and get support, and whether there's more we can do there. And then we also talk about waiting well, I think, in other parts of our services. And in this space, I was just thinking about the children and young people's voice. And it would be, we know that we often talk about the waiting times to get access to some of the services for children and young people's mental health, and that can be a long wait. But I think, I guess it'd be really interesting to ensure that how we help those young people during what can be a really lengthy period and get their perceptions and perspective on that and how they feel and what could be done differently, I think would be a really interesting area for focus. Thanks.
Jane, thank you. Colleagues, I'll ask you to come back in at the end so we can get through everybody, but there's some key questions there from Jane, and thank you for also sharing your day job perspective as well, Jane, working in universities. And waiting well is a theme throughout, but it has to be tailored to the group of people who are waiting, and it's a theme that's come through from Healthwatch on a number of occasions as well. So thank you for that. Brendan, then Therese, and then Mel.
Thank you. Brendan Brown, the Sector Lead for Acute Trusts. Great paper, would agree with all of the conversation and discussion, but we're talking about a marginalised group of children and young people. And to Heather's point, my view would be, how do we enable them to focus on living well and fulfilling their potential? So this isn't about health for me, but their health and the inequalities that they're dealing with. We need to lobby our national colleagues. I think the ask is about how do we look at what our subcommittees do within this committee. I'd be talking about what do we do with our national leaders to suggest something different for these young people. We are still expecting people to come out with an O-level and then to resit an O-level to develop in their learning or in their progression to jobs. And how is that right in this day and age when this group of children and young people have had the biggest chunk of their early lives disrupted by this? So I think there's a slightly different conversation and a different ask and a challenge to the status quo.
I have many questions from that, Brendan. So thank you. I think that's something to come in. I think there's some follow-up work that we need to do from this report. Victoria, I'll add you to contributing. So we'll go to Therese, then Mel, then I've just invited Richard as well, Victoria, and then we'll ask Rob to sum up at the end, and then we'll come back to you. Okay. So, Therese.
Thanks, Cathy. Therese Patton, Place Lead for Bradford District Craven. So I want to talk about the resourcing, actually, and the money. And we've talked about ambition. For those of us who are in the AGM this morning, we know that we spend half of the resources that we have in West Yorkshire on the acute sector. And actually, are we sure that that resource is being spent in the right way and doing what we need it to do? And Richard knows that I love proportionate universalism. And actually, we're trying to do some work on this in Bradford. Sahel, who leads this work for us, is in the audience. And we've looked at that population segmentation piece. And we're now gearing ourselves up to have some quite difficult conversations about where we then target our resources. Because resources are limited, we're going to have to take resources from some places to put resources in other places where we know there is most need. So I suppose it's about how we can do that in a way that is supported in place by partners, but also is supported and endorsed by West Yorkshire, because there will be challenges from colleagues and partners and citizens actually when they see that we're using resources in a different way. But I'm confident that through the work the Sahel team have done, that we have absolutely the evidence that if we target the resource in the right place, we will be spending it on the right people, young people and communities for the future of Bradford and Craven.
Thank you, Therese. That's really helpful. That's a key point in the paper about supporting the allocation of resource based on population needs, which is a theme throughout all our work in Sahel. Thank you for advocating for that and working with colleagues. And we can't pass up mentioning the Healthy Minds Apprenticeship Scheme in Bradford as well. I've met number of those apprenticeships who have very clear views on how health and care could be improved for them. So another great group of people to work with. Okay, so we then have Mel, then Richard, Victoria, and then we'll finish up with Rob, and then we'll come back to you. So Mel.
Thank you, Chair. I'm Melanie Brown, Wakefield Place Lead. I was just reflecting on this because the comment Jane mentioned was about how do we show we support children and young people who are waiting well for mental health services. And in Wakefield, we have a Wakefield support project which sees 1,000 children a year to provide some low-level interventions and group work while young people are waiting to access mental health services. I was also struck while we were talking together as a board about the work that we started on the SEND quality framework and the connections between that and some of the themes that have come out of this report. And I do want to sort of challenge Majid a bit about, you know, we do need to be able to evidence outcomes that we can do at a short term, medium term, because, you know, in Wakefield, we had some very challenging outcomes back in 2016, not just for our SEND cohort of young people, but for our social care cohort of young people and children in care. And within 4 or 5 years, with concerted effort, we've been able to turn some significant achievements around positive outcomes for children and people. So I think we've got to have focused work, and it can be done. And yes, there is some more longer term challenges around reducing health inequalities, but it's the steps to the journey that are really important. And I was also reflecting, you know, we've all got Children's Trust partnerships locally in places, and I'm sure that our SEND partnership boards would welcome conversations alongside our Children's Trust partnerships arrangements as well.
Mel, thank you. That's really helpful and chimes well with what Tim was saying on behalf of Leeds about setting those targets, those stretch targets. So there's a common theme coming out, and Carol's point as well in representing Kirkley is about what you aim to do yourself in terms of at place or neighbourhood level. Okay, thank you very much. Richard, coming to you, particularly with a primary care perspective.
No, thank you, and thank you very much for the report. I echo what Brendan, Tim and others have said, that really it's the social determinants of health which is the real key to this and addressing that, and that's for national politicians, local politicians and us as citizens to try and do our best to try and tackle those things and to make the right decisions that make that impact on most people. And I think that's a really important thing that clinicians need to remember as well, because I think as Tim ended his a contribution by saying it isn't just about inhaler technique, and I agree. But having said that, there is issues that we can do around the use of inhalers, and this system has worked really hard at improving our asthma guidelines and the pathways that we have, and increasingly a focus on maintenance and reliever therapy. For those of you who are not clinicians or have any knowledge around asthma, the traditional asthma approach has been to have a blue inhaler in your pocket, which is cheap, very effective for a few hours, but people keep using it and end up in the hospital because they use it too much, and when they use it sort of inappropriately. Increasingly, we now encourage as clinicians to use longer acting inhalers that are much more expensive. So a blue inhaler can be £1, a long acting inhaler can be £30, £40 potentially, maybe more. And so there is a reluctance sometimes in some areas, because we have been so focused around the cost of prescribing, not to prescribe more expensive inhalers, but actually they are much more effective because they keep people well for longer and then reduce their reliance on the use of short-acting inhalers. So I think one of the positive things that our system has done is actively encouraging the greater use of these more expensive inhalers, but more effective both for the individuals and for the system as a whole. I think the third thing I'd just like to say is that one of the points that the paper refers to is the 48-hour review project sort of in Leeds. And one of my colleagues in a primary care network in Leeds and the Seacroft area said that actually having a respiratory nurse focusing on children following their discharge has been one of the most beneficial things that they've had. We've seen really effective respiratory services focusing on adults, but respiratory services that really follow up children in the community and really try and proactively avoid them coming back again into hospital, I think can be really, really positive.
Richard, thank you so much. That's really helpful from your perspective in representing primary care, but as a GP working in Leeds, and it also connects well, Karen, with your point about how we go out into communities to support people. Thank you. Victoria, and then we'll come to Rob.
Thank you, Chair, and thank you, Sarah and colleagues, for the paper. I'm mindful lots of people have spoken. I echo lots of what's been said. Just a couple of additional comments which hopefully might be useful. Tim raised a comment around, and other colleagues, around level of ambition. And we're just really mindful that our new government has set this incredibly positive ambition around creating the healthiest generation of children ever, which is wonderful to read. But then the conversation was, so what does that look like then when you break down the kind of actions underneath it? But there may be something around how in West Yorkshire we want to echo that ambition in terms of creating that healthiest generation of children in our region. Going back to Sarah's point at the beginning around, this is around the contribution of the health and care system. There is so much going on right across society in terms of the social determinants and wider education, housing, etc. Everything is legitimate. There is something about how it all joins up together and how health and care colleagues can know what's going on in communities and be able to really confidently signpost to things that the health and care system might not lead on, but they know are really important. So there's something about that system and how it all works together. I was very struck by the absolute right focus around housing and health. I'm heavily involved in my own area around housing and health work, and it's incredibly important for us in local authorities. What was equally compelling, and it was echoed in the data pack, was for example, the proportion of children with asthma who are affected by secondhand smoke. It's about 80%. And actually, if you really consider the impact, there's a very strong argument for doing at least as much around secondhand smoke and the dangers of passive smoking for those particular children at most risk. So I don't think we should sort of miss out on those kind of very historic agendas that we're all still working on. Some people often say, oh, haven't we done smoking now? But not when 80% of children with asthma are exposed to secondhand smoke. And then finally, I know there's a lot of conversation at the moment about the kind of cross-cutting kind of health missions that are across government, as well as the ones that sit within the NHS and social care. And the big 5 R's which we can make the most difference around, which would apply to the children's population as well as adults, are smoking, alcohol, obesity, physical activity, and air pollution. So that for me, there's something about looking at where the most impactful interventions are around the things that we know make the most difference. And then very finally, I think there is something that we've talked about before, I know, with mental health colleagues around being really careful around separating the difference between positive health and positive mental health. And actually, if you look at them more holistically, we know that actually if you look at health in the round, you will get the mental health outcomes you want. Obviously, access to services plays a part, but it doesn't get us where we want to be with improved mental health for our children. So I think something about that, a more holistic approach around good health, both physical and mental, is something that feels important. Thank you.
That's really helpful. Thank you, Victoria. Robert, just wanted to invite you as our Chief Exec. I can see you've been making notes throughout and taking on board various suggestions and comments. What are your thoughts?
So firstly, really welcome the conversation, and wanted to sort of start with a mindset point, really. I think when we talk about integrated care, in people's minds, they often lead to adults or older people. And really we should be thinking about children and families as well, and that isn't always the case. And I think one of the reasons for that is that a substantial amount of the strategic leadership around children is with local government, rightly, because they're children first. And we should recognise that here, because it's germane. So the first thing is, when we think about join-up care, we should think about join-up care for children. I think the second thing is the points around ambition are really well made. So what do I know about ambition in West Yorkshire for children? Well, Leeds wants to be a child-friendly city and is a child-friendly city, wants to be the best city for children to grow up in. What does that mean in practice? Well, they've done a lot of work on what that means in practice. And through this, I think we've got to be crystal clear. What do we want our ambition to be around health inequalities for children? And in setting that, we need to say, what do we want that to be for the ICS? And what do we want it to be for the ICB? And I'll come back to that in a minute. And what we've also heard from Mel, and I also know from Leeds colleagues and having been in the system at the time, is that if you've got a group of priorities, you need to have a very small number of obsessions within the priorities, which you always come back to. And I think that this report helps us to start to think about what would those priorities be, what would the very small number of significant indicators that would be the thing that always lead to somewhere else. So if 20% of kids with asthma are off school, then we know that asthma and school attendance is linked, for example. So we should look at asthma. There's the core 20 plus 5, etc. So what are we focused on seems to me to be a really clear ask. And what I would say is from an ICS perspective, I think Victoria's just hit the nail on the head. There's a system-wide local government, NHS, third sector, societal piece, which isn't for us. As an integrated care board, if this is the board of the ICB, then we're there to support that. We play a supportive role. But the integrated care partnership, the partners across that and the strategy need to be saying through local government colleagues and partners, there's a big agenda here that we have to deliver on. And the ICB's got a role to play, and this is what it is. Now, I think that our role then, as an ICB, is to say, yeah, we won't allow ourselves the excuse that, of course, it's housing, we don't control housing, to get in the way of us looking at the core 20 plus 5 for children. What are the issues around asthma, diabetes, epilepsy, mental health, oral health? And have we got a plan? What are the targets? Are we delivering on those? How do they dovetail into the broader work? Because that's what we should be doing. And alongside that, I would say that we pick priority populations. So for me, that would be SEND and it would be care, children in care. So if we said, look, we here are going to do core 20 plus 5, plus those two populations, going to be crystal clear about the steps that we want to take to improve, building on the best practice that we've seen, and that docks into what the partnership's doing around delivering improvements in inequalities for children, recognising most of this is about education, environment, housing, etc. I think that would be a really good place to be. And in that conversation, we've got to recognise that a lot of children's services in the NHS are commissioned by local government too. So 0 to 19 services, for example, health visiting, school nursing. And we should have a plan for the money on that, as others have said. Because if we don't, we could be in a bit of difficulty. So I suggest coming out of the conversation, we alight on a very simple statement of those things and a bit of feedback into the integrated care partnership. There's some great work here. It's going to go beyond what we do. The assurance question that was posed to us about what do the committees do, we haven't mentioned the most important committees. It's the 5 place committees are the most important committees, because that's where the work is, and that's where local government and the NHS comes together with others. As we've heard, there's loads of rich work going on there. We need to be clear about what ICS in place are doing, what the place partnerships are doing, really. So that's where I would be. And, you know, if we also use our representative bodies to do the things that Brendan was describing about feedback to government with their missions, that there are some things that need to change, let's do that too. I hope that's helpful.
That's great. Thank you very much. I'm glad this report and this information and challenge has been really productive. Sarah, we've only got a few minutes left, but are there any reflections from you with your colleagues?
I'll be quick. Yeah, lots of reflections from me. I'll try and be brief. I think touching on, just picking up on what Rob was saying, I think we have this perpetual tension or challenge with working on a population health and having the benefit of having a population health function within an ICB, that we think, well, what do we do to add value within this space? And we kind of come up with a framework around what do we do? So if we don't do, does it get done elsewhere? So what do we do? What do we share? How do we influence? And what do we just need to be aware of that colleagues are doing elsewhere? They're cracking on with that. That's great. And I think with that in mind, there are some specific things that we need to focus on, that we need to do as an ICB. So we've kind of touched on things like asthma, that if we don't do, what might not get picked up elsewhere. I think there's some really good pockets of good practice we could share and scale up that we've touched on here and that touched on in the paper, and we've got a role in doing that as well. I think there's a big piece around influence and system connection and the kind of role of the health system that Fatima touched on at the beginning that's been a theme throughout. So housing comes out really strongly in here, but actually green space, transport, etc. We've got an option there, and we've got an opportunity and responsibility to influence upwards as well and influence into government in this space. And what do we need to be aware of? So I think the things that are happening locally that Victoria touched on in terms of the role of local government here, but also the voice of children or young people and the themes that are coming out around information. And that's important from an inequalities perspective because information isn't received equally and digested equally by everyone. So feeding that cultural competence element to the information as well as Karen's point on who are going into people's houses and how do we listen to the things that are coming back from our staff as well. So I think there's a piece for us around listening and continue to act on what we've heard. I think there's a piece around connecting the system to itself, which is always our role, but really kind of have an explicit role around that with children and young people. And then this thing that we kept coming back to around focus, around data, intelligence, but actually what's our role as a system. And I think we've got a partnership ambition around children and young people. I think we could be more focused on that as well. So there's lots of actions I've noted down as well for us to take forward, but they were kind of the themes I was hearing that we'll take back. I don't know if there's anything specific that you picked up.
Just really briefly, I think that summed it up really well. I think the thing that comes out loud, and I think we had the biggest impact, we've talked about the level of ambition, thinking about those secure data and environments, I think particularly for children. If there's a focus on looking at what happens in school trends, housing, police, youth justice trends as well as health as well, I think we'll be in a really good position to be able to tackle that when we do more of the not just thinking about health and clinical outcomes. A lot of this is to do with the social determinants, wider determinants. So how, if we've got a secure data environment, and there's areas that do that well, so I think there is learning out there across the country that we can learn from, but thinking about our level of ambition across West Yorkshire and what that means for children.
Great. Thank you very much. Sarah, I've taken notes as well, but there is a strong theme on that stretch, that ambition, that challenge, and that focus, particularly for place committees. If we take Rob's point earlier, the cohorts and communities of children and young people we want to focus on, and an invitation for everyone to take this report. But I think before they do, I'd welcome you going back to those recommendations and perhaps giving a steer or a direction from the conversation today. I'm grateful that you've been taking part in a task and finish group, which will soon close because we're now moving into the work and responding to it. But perhaps we could do that in the next few weeks that then can equip all our committees to take that further. And Bev, you mentioned earlier it's gone on to the other forums as well, which is really welcomed. Okay. Colleagues, thank you so much. There is never enough time, but I hope a number of you feel that you've had an opportunity to contribute. And if you haven't, please do. We'll continue with this. Rob, do you want to come back in?
I was just going to make a suggestion, if it's okay, Chair, if people agree. I mean, I do think this is great work as usual, and I'm always struck by what we're wrestling with here is there's so much good work. How do we make sure we're bringing it together to make the biggest difference, and we're really clear about who's doing what? Yeah. So I think it would be great following this conversation that next time you come back with a very short report that says this is what our ambition is. These are the areas of priority and focus for the Integrated Care Board. That's in support of the whole partnership's ambition on children. This is what we need to put into business planning for next year. I think that would be really helpful.
Thank you very much. And not lose that connection with the Integrated Care Partnership and how we work across different sectors with different leaders as well. Okay, we could spend all day on this, but I'm really pleased that we've had a moment just to focus in on that for you then all to take out into your work, and we can bring that back to the December board meeting. And we also have our partnership board meeting in October as well, where we can reference this. Colleagues, thank you very much. That is our Focus On session concluded for now. Sarah, you're going to come back at the December meeting to look at a different topic, taking a life course approach, and then you'll be back in March with another one, particularly looking at frailty then as well. So prepare yourself, there's more work to do, everybody together. We'll take a break now, so we will pause the meeting, and thanks to those who've been watching online and in person.